Thank you very much, Marcus, for your kind introduction. I have to say it's a great pleasure to be working with Marcus and his colleagues at BioSolveIT. We're very excited to be telling you about some of the work we're doing together, and also I'm all going to share a few of our sort of future ideas for where these sort of collaboration may go. But the main topic of my presentation today is guiding the design of high-quality compounds, and thinking about that in terms of predictive ADME modeling and multi-parameter optimization. So to give you just a little bit of an overview, I'm just going to just a couple of slides on a topic that's probably familiar to you, but optimizing ADME in drug discovery and what the objectives are. I'm then going to talk a little bit about predicting ADME properties, the different modeling methods, validation of those models, and their strengths and limitations. Before thinking about how we can actually use these predictive models to guide the design of compounds in the context of a drug discovery project, focusing on this concept of multi-parameter optimization and an idea we call the glowing molecule that I'll illustrate. And before I finish my presentation, I will just give you a quick taster of how some of these concepts can actually be applied in practice through a quick live demonstration. Obviously give you a pointer where you can find more information. And then both Marcus and I will give you a little bit of a taster of some of the future developments we're planning as this collaboration between Optibrium and BioSolveIT. So first of all, just a few words about optimizing ADME in drug discovery. I think it's pretty well recognized nowadays, and no great surprise to you, that a potent molecule is not the same thing as an effective drug. Potency is certainly necessary, but it's not sufficient to get a high-quality, safe, and efficacious drug that reaches the market. And the primary difference between a potent molecule and an effective drug is that we also need to achieve these so-called ADMET properties: absorption, distribution, metabolism, excretion, and toxicity. And as a sort of quick summary, of course, we know that a successful drug has to get into the body, travel to the site of action, and attain sufficient exposure, so sufficient concentration for a sufficient duration to have the appropriate pharmacological response, and then, of course, actually get excreted without causing toxic side effects. And we know that inappropriate ADME and toxicity is a cause for a large number of failures in drug discovery and downstream in development. And so our objectives in drug discovery can be really summarized as this idea of multi-parameter optimization. What we're trying to do is identify those chemistry with the balance of properties we know are required and in a safe and efficacious drug. This sort of sweet spot where all the different properties that we require come together. Obviously, potency against our target, physicochemical, ADME, and safety. And we also know we typically start a drug discovery project somewhere out here in potency space with a hit that is, of course, potent against our target, but it's very unlikely to have all the properties we need in a drug. And so we want to move as quickly as possible from this hit to this space of chemistry where we're most likely to find that high-quality lead, candidate, and ultimately drug. We also want to identify the situations when that balance is not possible. So illustrated here, where the space that will give us potency against our target does not overlap with all of the properties that we require. And of course, the way this is very commonly described is, fail fast, fail cheap. Don't waste time, effort, and money pursuing chemistries that are very unlikely to succeed. But of course, that's a very negative message. I've never met a project team that actually wants to fail. So we really want to add to this that we only want to fail when we are confident that that's the right decision to make. Essentially, when all of the data we've generated can convince us beyond a reasonable doubt that we're in this space and we won't find a good drug. At that point, it makes sense to move on to a new chemistry, a new target, or a new project, whatever that next step may be. And the reason I highlight the word confident is that we need to be aware and remember that all of the data we deal with in drug discovery has significant uncertainty. The experimental measurements we make have significant variability, and of course, as we're talking about today, any predictive models we have will have significant statistical uncertainty. So bearing those objectives in mind, I'm going to talk a little bit now about predicting ADME properties and some of the methods that we use, and then think about some of their strengths and limitations in that context. So if we're thinking about in silico models for predicting ADME, there are a wide range of different methods that are available to us. Probably the most common are the so-called quantitative structure activity relationship models, QSAR models, sometimes known as quantitative structure property relationship models. And this is essentially based on fitting a mathematical model of molecular features to a set of experimental data. So it's an empirical model of observed experiment. Other approaches include quantum mechanical simulations, where we're trying to understand reaction mechanisms and predict those, particularly for properties such as metabolism, for example, by cytochrome P450. That's another area that we work in, but it's not something we're going to focus on today. Expert systems are based on rules that represent experts' knowledge, and these are particularly used for identifying sites of metabolism and metabolites and structural alerts, if you like, for toxicity. And of course, there are physiologically based models, particularly for modeling pharmacokinetics, so-called PBPK simulations. And these are particularly useful for combining individual properties, whether experimentally measured or predicted, and simulating the in vivo pharmacokinetics, for example, to make clearance or exposure, half-life, and so on in vivo. So there are a wide range of different tools that we can bring to bear to predicting and understanding ADME and pharmacokinetics. For the purposes of the rest of the talk, I'm really going to be focusing on this QSAR approach and looking at how we can use that to predict ADME properties based on structure alone. So to drill down into a bit more detail, a QSAR model is, as I've described, a mathematical relationship between a set of descriptors, simple characteristics of a compound, and some observed property, just shown as X here. And so what we're trying to do is to fit this mathematical model to a set of known experimental results. So the starting point for this must be high quality data. There's no point in merging together data from lots of different sources measured with different protocols or different assays and hoping to pick out a structure-activity relationship. In that scenario, you're more likely to pick out the noise, the difference between the assays, than the actual relationships between the structure of the compounds and their biological property. And in particular, if you're going to use public domain data, this needs very careful curation. And there's a nice paper published recently in Journal of Computer-Aided Molecular Design describing some of the pitfalls of using this sorts of data. And we also need to be aware that sometimes public domain data just isn't good enough to build a high-quality model, and you need consistent data measured with the same protocol in the same lab to really get that high-quality model. The next sort of ingredient, if you like, are the descriptors, these characteristics that are the input to this mathematical function. And again, there are a whole range of different types of descriptors. Very commonly, we look at sort of whole molecule properties like the log P, the molecular weight, the polar surface area, and so on. And also structural descriptors that capture key functionalities and their relationships. They can be represented, for example, as smarts or substructure patterns, fingerprints, and so on. And then having calculated a range of descriptors and got some data to fit the two, then what we need is a statistical or machine learning method to fit this mathematical function. And this ranges from simple linear methods like multiple linear regression or partial least squares to more complex machine learning methods like neural network, Gaussian processes, support vector machines, random forest, etc., etc. But if we have a model, we need to, or we're building models, we need to think about some key questions along the way and key issues we need to address. Particularly, if we're going to make a prediction for a compound, we need to sort of understand the confidence we can have in the predictions. I guess the ultimate question is, can we actually trust a model? And if so, when? And if we can, how much? You know, what degree of resolution does that model give us? And once we make predictions based on a model, we'd like to interpret that model. We'd like to understand what it's telling us about that structure-activity relationship that it's recognizing in our compounds, and provide guidance on how to design compounds to improve their properties and overcome issues. And then, given the limitations of models, how and when can we actually use these models' predictions effectively? And what we'll do is discuss a few of these issues as we go through the next slides. So in terms of model building, obviously, as I mentioned, it all starts with a data set. And then to be absolutely rigorous, what we do is to actually split that data set into 3 independent test sets. We call them the training, validation, and test sets. And then we can calculate a whole range of descriptors, sort of whole molecule, substructure counts, and so on. And you can also clean these descriptors up by removing highly correlated descriptors or invariant descriptors that have no information about the difference between molecules in your data set. And then we use this training set to actually build models. And what we've discovered over the years, like many people have, there's not one modeling method that you can sort of hold up and say this one is always best. And so we use multiple modeling techniques, ranging from simple partial least squares, methods based on radial basis functions, several methods based on Gaussian processes, random forests, and so on. A whole range of different methods. And so you can build multiple models, but then you have the question, well, which one is actually best for this modeling problem, for this chemistry and this data? And so what we do is we use the second set, this independent validation set, and we actually run all of the models against this set and evaluate them and select the best model by the performance in the validation set. So this is actually a test of the predictive power of that model on a new set of compounds. And we pick the best one. But when we do that, we need to be aware that this process of comparing, maybe dozens of different models against this validation set is to some extent training to that validation set. And it's possible to find a good model by statistical chance. And so to be absolutely rigorous and have a well-validated model, we then take the best model and test that with an external independent test set. Again, to test its true predictive performance against new compounds. And if that's a robust model that can be used with confidence, then we should see the performance on the test set is similar to that we saw on the validation set. We're not fooling ourselves by luck, if you like, in finding a good model on the validation set. And so that's a rigorous process that ensures independent validation of a model at every step. But when we're actually assessing that predictive ability, there's a few statistics that we need to sort of keep in mind. The primary statistic we look at is the so-called coefficient of determination, or R squared. And that's a measure of the fit of the model to the identity line, y equals x. So here we have the observed values versus predicted, and the identity line is shown in blue here. And if we had a perfect model, all these points would sit along that line. We don't, and so the R squared gives us a measure of the fit between 0 and 1, where 1 is ideal. But note that this is not the same as the squared correlation coefficient we denote as R squared correlation. That's a measure to the best fit line, so that in this data set it's shown in orange. And so we've got a good fit here, an R squared of 0.86 for the correlation in terms of the best fit line. But notice that best fit line is not the identity line, and so in fact this coefficient of determination is slightly lower. It's a stricter test of the performance of the model. And we also look at the root mean square error. That's a measure of the variability, the uncertainty, the statistical error, excuse me, in the predictions from the model within that validation set. And if we're thinking about classification, so instead of predicting a number, we could have high, medium, low, good, bad, whatever that might be, then I guess the most common statistic one sees is the model accuracy. But we need to be very careful about using that. So here's an example of a situation where we've got an accuracy of 92%. And that's great if we had a well-distributed and nicely balanced data set between, in this case, high and low classification. But here you see a very highly biased data set. So although it gets most of the high compounds right, it's actually very poor at predicting low. And so we also look at the so-called kappa statistic, which is essentially corrected for the expected performance of no model, essentially correcting for the performance of a random model, which in this case would get almost all the compounds right just by predicting high. And we also consider statistics like the sensitivity and specificity to ensure that we can use that model with confidence for the question we're trying to answer. But once we're looking at the performance of the model within a validation set, we also need to think about where that model can be applied with confidence, the so-called domain of applicability. And the domain of applicability is really defined by the diversity of the training set. And so here we have a simple example, just with two descriptors, because it's easy to draw, where these gray points represent compounds used to train that model. And this ellipse sort of represents that area of descriptor space where that is well represented by that training set. And so if we had a new compound we were making a prediction for, something like this blue star here that lies sort of deep within that domain of applicability, we can make a prediction with confidence, and we have a good feeling for the uncertainty in that value from the validation, that root mean square error in the validation set. If we have something like this green star that lies outside of the domain of applicability, the model is beginning to extrapolate beyond what it knows. So the confidence in the prediction will go down. Essentially, the error bars around that predicted value will be larger. And in the extreme, you might have something like this orange star that is sort of way outside of that domain of applicability. And of course, the model can generate a number, but frankly, we have no idea how trustworthy, how confident we are in that value. Essentially, there's no experimental evidence to support a prediction for this compound. And so we would show that as essentially an infinite error bar and saying, hey, really this is outside of the domain, use this data with extreme care. So for a simple model, you can represent this domain of applicability. We do in many of our models use a Hotelling's t-squared test to represent this domain of applicability. But actually there are more sophisticated ways that we employ for some of the more advanced modeling techniques. For example, the Gaussian processes technique. And what this does is it actually fits a probability distribution over all possible models that explain the data. So it begins with a prior distribution over possible functions, so essentially spaghetti. And then the actual modeling process fits a posterior distribution. Essentially, it retains the functions which explain or fit that experimental data. And so you can see here a variety of different functions, each of which have a reasonably explanatory power for these experimental points shown as x's. But you can see areas where you have more confidence in a prediction and areas that are less well represented by that data that we use to train the model, and hence where the uncertainty is higher. And so we can make a prediction which is the average or mean of the posterior distribution. But really importantly, you can also estimate the uncertainty in each individual prediction as the standard deviation of this posterior distribution. And that gives you a measure of confidence for every individual prediction. It's not just in or out of a domain of applicability. And here's just an example of its application. So here's a distribution showing the actual absolute error of a prediction for a data set of an independent test set of compounds. This is a model built with a Gaussian process. This shows the number of compounds in each of these bins. And what you can see is if you have the green here is the low estimated standard deviation, less than 1 log unit in this case. You can see that that really represents the vast majority of the accurate predictions. And I guess what you'd see is about 95% of the green points lie within 2 standard deviations, which is, I guess, statistically what you'd expect. But actually, most importantly, the really inaccurate predictions out here are flagged as having a very low confidence. In this case, I've just highlighted those as estimated standard deviation greater than 1 log unit. And so it's very nice in being able to identify those outliers where we have very low confidence in the prediction. So, just a few of the issues around building, validating models, and understanding where they can be applied and with what level of confidence. And so now we want to think about how we can actually guide design with these resulting models. And of course, it comes back to this multi-parameter optimization idea that I mentioned. This is the slide I showed you before, where we're trying to identify the balance of properties. We're also trying to identify those situations when we cannot find a high-quality compound, but do so with confidence, because the last thing we want to do is to miss the opportunity to find a good drug due to an uncertain measurement or uncertain prediction. So probably the most common way of bringing together data for multiple properties is filtering. And so I'm sort of illustrating filtering as an analogy of finding a diamond hidden in a pile of coal, where of course that diamond is that sort of perfect compound that would be a successful drug. And if we were filtering, we would start with a property, I guess pretty commonly potency, either the result from a high throughput screen or a prediction from a model, a pharmacophore model, or a score from a docking model, something like that, and we would throw away the compounds that didn't meet our potency requirement. But we're not talking about one property here. The idea is multi-parameter optimization. And so maybe we might look next at absorption. Again, experimentally, it might be CACO2 or MDCK or PAMPA, or it could be a prediction from a QSAR model. And we throw away the compounds that don't meet our absorption requirement. And then maybe metabolic stability, microsomal stability, hepatocyte stability, whatever your chosen endpoint might be. And of course, we don't just look at 3 properties in drug discovery. We might look at 10 or 15 different properties we want to optimize simultaneously. So we put them through this big, long chain of filters and hope that out of the bottom comes our diamond. Well, that would be nice if it happened, but I'm guessing you probably realize that it's never that easy. And sometimes this happens, and nothing comes out of the bottom. And then you've got a big question. Is it because there was no diamond there in the first place? Are we in one of these areas of space where these properties don't overlap? Or have we made a mismeasurement or a misprediction somewhere along the way and incorrectly discarded this diamond? And if so, where do we go looking for it in this big pile of coal to find that missed opportunity? Even worse is this outcome, where incorrectly a lump of coal comes out of the bottom, and we spend months or even years trying to optimize this only to achieve one of those dreaded late-stage expensive failures. And the question I'd like to ask is, well, how likely is this outcome? So for example, if I had 10 filters that reached 90% accurate in making the correct yes-no decision, it's a very good scenario to be in. But in fact, in that situation, the probability of that diamond emerging, even if it's there in the first place, is only 35%. In other words, I'm more likely to throw away my best idea somewhere in this process than I am to keep it. And for that reason, we suggest you treat filtering with caution. Sometimes it's necessary, but be aware it's a process that accumulates error without that being transparent. So why am I telling you this? Well, we use a different method. We call it probabilistic scoring because, as the name suggests, it's based on probabilities. And lots of description. This is a review article at the bottom here that discusses the strengths and weaknesses of different methods and goes into much more detail about this. But essentially what it allows you to do is to define the properties that you are interested in. This could be predictions or experimental data. Define the criteria that you are looking to achieve in each of the individual properties and the importance of each individual criterion to the overall objective of a project. Because we know not all properties are equal. You know, we must have a potent compound. That's very important. But there may be properties we might be willing to compromise or trade off. And we can define that balance and that trade-off. And just to point out that you don't have to have sort of hard cutoffs or filters. You can actually use so-called desirability functions to sort of be more subtle about the distinction between compounds. It's not good or bad, but there are sort of shades of gray, or in this case, sort of orange in the middle. And then what probabilistic scoring does is to bring together all of your property data, experimental or predicted, assess them against those criteria for success for your specific project and their relative importance, but explicitly takes into account the uncertainties in the data, that experimental variability or statistical uncertainty that we've been speaking about in terms of models. And it scores the compounds for their likelihood of success, that is, the probability of achieving the ideal outcome for your profile. But beyond that, it also calculates the confidence in the overall score given all of that underlying uncertainty. And so one way to look at it is shown here. This is a graph where essentially on the x-axis we've ordered the compounds by their score. So the best are on the left to the worst on the right. And on the y-axis we're showing the score itself, that chance of success. And here you can see the best compounds in this data set have about an 80% chance of success. What I hope you can also see is around each of these points is an error bar, and that shows the confidence in the overall score given all of that underlying uncertainty in the data. And so there's actually much more information here. For example, if we look at these top 5 compounds, you see their error bars overlap almost completely. And what that's telling us is that the data we have so far do not confidently distinguish between these compounds. I can't go to a project and say, right, that's number 1, go for it. You would either need some better data with smaller error bars or another criterion with which to choose between those compounds. On the other hand, roughly 50% here, you see the error bars don't overlap, so we can reject those with confidence, save that time and effort, and maybe explore this chemistry further, gain some additional data, or try some other compounds. And of course, having prioritized our compounds, we also want to have some guidance as to what are the critical issues we need to address to improve their chance of success. It's all very well to say, yeah, this is better than that, but if I want to get something better, what do I need to sort of focus on? So here's some examples. This sort of, whether you look at it as sort of a histogram like this, you can see the low bars are the ones that are the main issues, colored by a key, or whether you use a heat map like this, you can see that the bright red indicates a critical issue that is not only a poor value, but with high confidence for a very important property, in this case potency. In this case you see log P, this light blue bar, is the issue with this compound. So that can help you to say, well, what are the issues? But obviously the other thing we would like to use predictive models for is guiding as to how can we actually improve those compounds, and using that structure-activity relationship in a predictive model to guide that process. And so what we're really thinking about is the influence of the descriptors in the model on the property we're interested in. So here's a very simple linear model. So here we've got 2 descriptors, again very simple just so I can draw it, and a property that we're trying to predict. And if we're making a prediction, what we do typically is look at the values of these 2 descriptors and then calculate essentially the height of that surface, and that gives us our prediction. And for a simple linear model like this, what you can see is no matter where I am on this surface, then essentially to increase this property, I want to increase descriptor 1 and increase descriptor 2. But life isn't linear. And more often, we use non-linear models like this, where we've got some relationship between these descriptors like this surface. And in that case, if we have a couple of descriptors, we can calculate their values, look at the height of that surface, which gives us a prediction of our property. But notice now that the direction that most strongly influences that property will vary according to where we are on that surface. And so we can look at that in terms of sort of individual descriptors and sort of look at the local direction which will have the greatest influence on the value of that property. And so we can consider each of these descriptors individually. But then, obviously, we have multiple descriptors that go into a model. And so here are two molecules, A and B, and here you can see three different descriptors. Again, just simple descriptors for illustration here. And what you can see for molecule B, increasing the number of molecule A, increasing the number of aromatic rings will increase that property. So here you can see that the aromatic rings are highlighted in red here by these circles to say that those features of the molecules will tend to increase that property. On the other hand, in this case, the increasing the number of amide groups will decrease the property here, and so they're shown in blue. And essentially, the nitrogen count doesn't really affect the property around this molecule, and so you see they're shown here in green. And that may be different for different molecules, and so you can see the pattern on molecule B is quite different, even for the same functional groups. And when you bring that all together, you get something we call the glowing molecule. And what this is doing is providing that visual interpretation of the sort of key structural influences on the predictive property. And answering those important questions, if you give a structure to a model and say, what's its property? It says good, bad, high, low. Well, your questions are, well, why has that model predicted that property? And more importantly, where can I change that molecule to have the biggest impact on changing its property? This in the bottom right is very simple. It's actually for the log P, so you'll recognize the red regions are those that have the greatest effect to increase the lipophilicity, while the blue regions have the greatest effect to decrease the lipophilicity of that compound. So it's an interpretation of the SAR and helping to sort of guide that design process. And as I just illustrated, this can apply equally to linear and nonlinear models, and sort of avoid those nasty black boxes where it just says good, bad, and you don't understand why. So those are a few concepts. And what I thought I would do is just very, very quickly, just in 5 minutes, sort of illustrate a quick workflow to show you how these can actually be used in practice. So I'm going to drop out of the slides, and I'm going to do this sort of live in front of you. So I've got a copy of our StarDrop running. I've already loaded a data set. This has 191 compounds in it, and I've got a structure for each compound, an identifier. This is experimental data. In this case, it's an experimentally measured PKI value of potency against the target, which is neurokinin 2. And you'll see in this data set, I actually have several different series or chemotypes within this data set. And I guess the sort of scenario here is sort of early on in a project where you've got some primary screening data. What we're trying to do is identify a high quality lead series for our project. And here I'm just showing on the left a simple box plot with the distribution of the potency for each of the different chemical series. And you can see the most potent compounds at the top here. If you grab them, you see they're all from this amide oxime series. But of course, as we've just been discussing, the most potent compounds are not necessarily the best starting point. And so what I'm going to do is actually now supplement this experimental data with some predictions from the sorts of ADME and physicochemical property models that I've just been talking about. While that's running, I'll just point out sort of models of physicochemical properties like solubility and lipophilicity, in vivo properties like blood-brain barrier penetration and human intestinal absorption, and important interactions like P450 inhibition, hERG inhibition, PGP transport, plasma protein binding, and so on. And also, because we like to keep an eye on them, this sort of typical rule of thumb descriptors like molecular weight, hydrogen bond donors, acceptors, polar surface area, rotatable bonds, etc. And while I've been talking, you'll see here that it's run all those calculations. And now, of course, you see that the typical challenge is essentially data overload. We've now got 22 columns for 191 compounds, and the question is how we use this to find that sort of high-quality chemistry. And of course, remembering that each of these data points has uncertainty. So the model predictions, just double-click on one of these, you can see estimate not only the value, in this case of solubility, but the uncertainty in that value. In this case, this compound is quite different from the training set, and so therefore it's got quite high uncertainty, about plus or minus 1 log unit, which is pretty typical of a solubility model. And of course, the experimental data also has uncertainty. So you see here that the variability in the assay in this case is about 0.3 log units, or a factor of 2 in the Ki. And of course, this idea of multi-parameter optimization is where we can sort of bring together all of this data in a rigorous way. You can see here this sort of profile of properties that this project has defined, obviously looking for a potent compound, good solubility, good absorption for an orally dosed compound, the right range of log P, and so on. And if we score those compounds, what we generate is a score that represents the likelihood of success, that is, the probability of achieving the ideal outcome that we've defined. And I've just sorted these to show that the highest scoring compounds in this data set have 20, 30, I guess almost 40% chance of success, which is pretty good at this stage of a project, given all that uncertainty in the data. So let's just look at this in a slightly different way. I'm just going to switch to something we call card view, where each compound here is represented by a card. So just to show you, here we have a structure of a compound on the card. Here is that primary activity, that measured value, and my multi-parameter score against this profile. And just to show you, I'm going to color these by the potency, from the highest in yellow to the lowest in red. And if you click OK, just to point out, the card in the top left, the compound in the top left, is my highest scoring, whereas the one down in the bottom right is the lowest scoring. So it's sort of sorted in order. And immediately what you can start to see is that the highest scoring compound here in the top left is not necessarily the most potent. In fact, this one here has got a lower score, but you can see from the color is more potent. So, one of the things we might want to understand is, well, why is that? And if you sort of zoom in here, you can start to compare very easily, and you see this about 1.5 log unit higher potency, yet a lower score. And the histogram sort of shows you why. I think the blue and the pink bars. But you can also drill down and see immediately from these predictions, at least, it's suggesting that, I guess here, log P, the light blue, is significantly higher, so additional risk. But particularly here, the predicted hERG inhibition is very, very high. And so this would be a significant additional risk factor, and hence the overall score is lower. So you could look at individual compounds, but what I'm just going to do now is to stack these compounds up. I'm just going to stack these cards by the series to which they belong, and that creates these little stacks. So you see there are actually 6 series in this data set, each one represented by a stack, and on that stack what you're seeing is the distribution of the potency shown here as a histogram, and also the distribution of the score shown here as a box plot. And so what you can see, this series, for example, is very low potency, so not very interesting. This amide-oxime series we saw before is extremely potent, lots of very potent compounds, but actually the scores here are not looking so good. There are a few decent ones, but actually the distribution is pretty poor. So perhaps some issues with physicochemical and ADME properties. Whereas the one on the left here, this phenylpiperazine series, has a broader distribution of potency, but some of those very potent compounds also have good scores. And so it looks, that's very interesting. We've got some interesting SAR, as well as being able to access space that is at least predicted to have good physicochemical and ADME properties for my overall requirements. So it looks, from this very quick, admittedly, analysis, that this phenylpiperazine series is the best. But we do have to ask that question about how confident are we, how sure are we that that's the best series before we go too far down one particular route and sort of bet our entire project on a single series. If we're working with predictions here, we should probably validate that predicted hypothesis. And so what I can also do is create one of these plots like I showed you in my slides. Let me just detach that and make it a little bit bigger. And then what you can see is, if I expand this out, is actually the error bars around these points suggest that maybe really we can't distinguish between maybe the top 30 compounds in this data set. you see the error bars overlap. And so if I grab those top 30, you see they're selected here in the graph, but they're also selected in my little stacks, the blue sort of fill. And now what you can see is actually, although yes, that series looks to be the best, in fact, it's highlighted a small number of compounds in 4 of these other series that suggest we should not necessarily reject those yet with confidence. And a more rigorous strategy would be at least to sample a few of these, get some experimental data, confirm that predicted hypothesis before going too far down one particular route. So that's this idea of sort of balancing. Yes, focus on the quality, but bear in mind the uncertainty in the data and explore an appropriate degree of diversity to avoid those missed opportunities. Now, just the last little step in this example, obviously we've looked at quite diverse chemistry, but we're also interested in the SAR. So I'm going to grab that series, and I'm just going to grab that into a new data set here. Again, if I sort by the score, because one of the other things we're interested in is, can we actually find strategies to improve compounds further? I'm just going to go back into card view and just change my card design to get a little bit more data. So here you can see I've got the structure, the score, and 3 other interesting pieces of data, the potency, predicted log P, and hERG. And what I might be interested in is this is my highest scoring compound. What's the structure-activity relationship around that compound that's driving the activity? Can I find new opportunities for optimization? And so I'm just going to quickly look at the nearest neighbors of these compounds by the potency. And just to show you, this is the compound I selected, that highest scoring compound. This is its nearest neighbors using a 2D similarity, just a Tanimoto similarity. Next nearest, and so on. And for the closest neighbors, I'm showing a link where the arrow shows me the direction in which the activity is increasing. So this is a more potent compound than that, and the color tells me the size of that increase. So a bright red link like this is a big change in activity, while the gray link is very small. And so of course what you're seeing here are activity cliffs. A short red link is a small change in structure that drives a big change in activity. And actually, in this particular case, I've sort of zoomed in, so you can see that the only difference between these 2 compounds is that this pyrrole group has been replaced by a phenyl. That increases the activity by 1.5 log units, but actually, similar to the example we saw before, decreases the score because, in this case again, the log P has gone up, and the hERG inhibition looks to be a particular issue. And this is that idea where using models to guide design can be very valuable. So if we go to the designer here and select this compound, we know that the phenyl here is really having a very positive effect on the affinity. The target really likes that, but it's having a bad effect on hERG. So let's click on that, and now we can use that glowing molecule to use at least the model's understanding of the SAR driving that hERG inhibition and help to figure out where can we change this compound to have the biggest impact. So these red regions are those tending to increase the hERG inhibition the most. The blue regions tend to decrease it. So again, do something obvious, but you could try something like changing this into an amide so that we can essentially affect the pK on the nitrogen, but here you see the models identifying this as a blue region, and indeed the hERG inhibition is at least predicted to go down by about a log unit. So trying to use that SAR to help with that thought process around where to change that compound to have the biggest impact. Anyway, I am aware, I do apologize, I've run a little bit over the time I had planned. I want to make sure that we leave some time to talk to you about some of our future plans. So I'm just going to wrap up. Obviously, I've just shown some examples of those sort of concepts that I talked about in my slides. I've only scratched the surface of what StarDrop can do in terms of not only the scoring, but chemical space analysis, more data visualization, as well as the interactive design and the glowing molecule. A wide range of plugin modules that extend StarDrop with predictive modeling, de novo design capabilities as well. Again, I'm not going to talk about that now. And I'll just leave this slide up for a second to show you where you can find much more information if you are interested on StarDrop and case studies, and then also all the publications that I referenced in my slides are on the Optibrium community, so you can download and look in more detail at the underlying science. My email address, you're welcome to contact me, matt.segall@optibrium.com or info@optibrium.com if that's too much to remember. So thank you very, very much. I'm going to hand back to Marcus, who's going to talk just in the last few minutes about some of the plans we have for working together to bring this sort of world of 2D SAR together with the world of 3D SAR and structure-based design that is encompassed by the CSAR product of BioSolveIT.
Okay, thank you very much, Matt. That was a very instructive webinar block so far. We're not yet done. We're still looking out into the future. Before we do that, actually, I would like to pop up the next poll to find out how much experience people already have there. And there are lots of questions already popping in for the discussion afterwards. So let's see whether this shows up. So do you actually see the polls? If so, please give us a quick hint on your experience with either CSAR or LeadIt or StarDrop. And replies interactively come in here already. Relatively balanced as it seems. And I think it was a very good idea, Matt, to actually have you here. You will see in a second. Because people definitely seem to be wanting to know more about StarDrop. So I'm going to close in 5, 4, 3, 2, 1 second, and I'm beaming this over here. So CSAR, although being a relatively young product, comes back with quite some experience. LeadIt, okay, it's a quite a mature program actually, with lots of modules in there, and StarDrop 13%. Well, obviously we used our email contacts, our Facebook groups, etc., especially these to propel the information about this webinar, and it seems like we've done right to collect an orthogonal group of interested people. So Matt, I'm pretty happy. Seems like you told people a lot of good news so far. Closing for this for now. And I'm grabbing authorship back in a second. Just 1 second. And I'm going to transfer my screen here. Okay, so coming back to the question, what is available today from this collaboration that we embarked on only, well, not even 2 months ago? Well, we do have a first release of CSAR out there where we have the most simple visualization that we thought of before your eyes, namely especially the selected properties that the StarDrop engine computes for you, and we just feed them into the CSAR table here. I explicitly left this as the original mockups that we circulated amongst of us. But you find out yourself, just download the executables or the test package and see for yourself how it's actually implemented in there. So this is actually done. And also filtering, sorting, and everything being at the same time ADMET and 3D aware. You just select the properties that you like to be visualized in the table, and actually you can export them also into an SD file for further post-processing in your favorite tool, which of course is either one of Optibrium or our society ones. That's also done. So let's imagine, what if StarDrop further came into CSAR? Here are a few ideas. Oops. So let's fire this up again. 1 second. So here we go. No, change screens. So, of course, the glowing molecules in CSAR, that would be fantastic, I think, because you would do interactive compound optimization in 3D with all the information that you would want to have available at the same time, both in kind of a table or data display view, but interactively in 3D. So this is a mock-up. This is not yet done, and we'd be very happy to actually have your feedback on these things as well. Focus on your relevant property for the glowing molecules in 3D, just as an idea. Another idea that we have is to bring fragment-based ligand design and StarDrop together to actually be able to do a multi-parameter optimization in the context of fragment-based ligand design. So you'd be guided by structure, if you want, and properties at the same time, and do de novo discovery of molecules with visual guidance of the properties that are important for you. Or use 3D derived data to actually train StarDrop. So you could, for example, perform a docking or interactive editing in 3D and use that information that you generated there in 3 dimensions to feed it back into the training engine underneath StarDrop and collect feedback from there and get into kind of an iterative cycle to further optimize your compounds while letting existing knowledge or newly created knowledge be flow back into StarDrop. I think that would be fantastic, really. Okay, enough of this brainstorming. Please just let us have your feedback on this by email, in the chat box, in the question box, etc. But there is, of course, also the other side of the coin. What if QSAR came into StarDrop? There are even more ideas. And with that, I would like to change back and switch back to Matt being moderator here, or the what do you call that, the presenter. Here we go. And Matt, I think you should be able to show your slides again. Yep. And it may be that you muted yourself, so currently I don't hear you.
You're absolutely right. Thank you. So I was going to say I'm going to keep this very brief because I'm aware we have officially run out of time. But of course, there's the flip side, and we're working with BioSolveIT to bring this sort of 3D structure-based design world into StarDrop. And so at the sort of simplest level, thinking about how we could actually bring in the 3D world of QSAR so you can understand that 3D SAR, the interactions with your targets, the estimated KIs, and so on, into the same StarDrop environment that I just very quickly touched on. And of course, include that information in the multi-parameter optimization, the probabilistic scoring, so that we can look for compounds with a high predicted or estimated KI with all of the other properties as we're designing and considering 3D strategy for optimization. And another thing that we believe is very important is the ability to link the sort of 2D SAR analysis that we do with the 3D view of the world and the target interactions. To make sense of those sort of patterns you see in the data, I showed you the example very quickly of this activity landscape where we've got a reference compound here and close neighbors where there are, in this case, they're all less active than that reference. And understanding these activity cliffs, these big changes in structure, big changes in activity that are driven by small changes in structure. So this is a very quick example where we have an analog of sort of rosiglitazone, so it's a thiazolene dione docked into the target here, the PPAR gamma target. You can see here the thiazolene dione is sort of docked into the pocket. And I'll just notice a couple of things here. This, for example, and this phenyl group has a meta substitution and is a propyl group here. And if you look at this, you can see here from QSAR and from the hide scores that propyl group forms a very nice interaction with a hydrophobic cleft in the pocket. So, yeah, very good and a very active compound. That looks great. But if we look at this compound here, you can see it's much less active. The red arrow points inwards. And if, again, you look at this in more detail, you see almost 2 log units of activity lost here. And actually, there's only really a very small change, which would be gone from the meta substitution on this phenyl to the para. And we'd like to understand why. And indeed, if you map across here now, you can see the pose that's generated, and that begins to understand. You see this, essentially, this propyl group, although the changes at the substitution point on the phenyl, you can actually see the effect it's having is that propyl group misses that nice little hydrophobic pocket. And that's driving down the activity. And there's a third example here. Again, much less active. Same para substitution. Now you've got a sec-butyl group here, and in fact now what you begin to see is this bulkier group, it misses the pocket and it in fact completely disrupts the binding mode. Here you see the thiazolene dione is now pointing out the solvent. So clearly it cannot bind in the same orientation. So it's, we think very powerful to analyze your data, understand those patterns, but then where there are these critical differences, be able to understand the reasons and the explanation for that in 3D. So again, one example how that sort of 3D world can come to StarDrop in this sort of multi-parameter environment. And that is where I will stop once again. A hand back to Marcus. I think he has sort of one more poll question, and we'll be very happy to answer any questions that you have.
Yeah, absolutely. Thank you, Matt. We do see that only very few people have left so far, so to my impression, it's worthwhile investing another 5 minutes to get feedback from you guys and especially answering questions. So very quick poll. Help us prioritize what would be actually the most useful for you. So these new software features that we thought of here in terms of a brainstorming, how often would you use those? The glowing molecules in 3D visualization of structure-based design in StarDrop, or high affinity estimations in StarDrop, the torsion calculations in StarDrop that we have not yet focused on, but you can see how healthy torsions are in terms of a statistical analysis, or even full post generation in StarDrop. Wow, that's a pretty impressive feedback that I'm going to show you in a few seconds. Still heftily being responded here. So I'm closing in 5, 4, 3, 2, 1 now. Conveying this. Glowing molecules in 3D is definitely the winner. Visualization of structure-based design in StarDrop, equally up there. And then roughly 30% hide in StarDrop torsions, in StarDrop full post generation in StarDrop. That's very interesting. Yeah, thank you. Thank you so much for this feedback. I'm closing this. And in the interest of time, maybe we jump to the Q&A session here. So a lot of questions, Matt, that drop in actually refer to the applicability domain. So one attendee is asking, how is this actually calculated, this applicability domain? You may want to switch back to to one of the slides that you showed. Another person asked, how do you actually calculate the distance from this applicability domain? And another person asked, how many compounds do I actually need to build a useful model using StarDrop? Is there a gut feeling that you have, or something that you can convey to the fellow users here?
Yes, absolutely. So the way in which we calculate the applicability domain does depend to some extent on the type of model, as I introduced in my slides. So for the simplest models, which don't have an inbuilt estimate of confidence, we use a Hotelling's t-squared test in the descriptor space of the model. And so what we look at is the confidence that the new point lies within that sort of cloud of compounds in that descriptor space, using, as I say, Hotelling's t-squared test. And that is we've compared many different methods, and there's not one method that is always best, but this seems to be good and reliable in the vast majority of cases. But actually, the other approach is much more sophisticated, where you have these sort of ensemble-based methods. Particularly, I illustrated Gaussian processes, and here you're looking at not only whether you're sort of in or out of an applicability domain, but actually how well supported each individual calculation is by the data in your training set. So that goes to how close those compounds are in the immediate vicinity of your new compound in the descriptor space. But actually, it also captures another thing that's very important, which is how much variability do you see within that region? Because if you see a lot of compounds that are very close, that would suggest it's well supported. But on the other hand, if the properties of those compounds that are very close vary wildly, that also limits your ability to make a good prediction. And so these sort of ensemble methods actually capture that information very nicely. The Gaussian processes method that I illustrated. And so it's more sophisticated than a simple applicability domain, but it does capture that proximity of a new compound to those used to build the model. In each case, we use the descriptor space of the model itself. So that's a quick answer to the question, but I hope sort of captures the key points.
Right.
The number of compounds used to.
That's the one.
Pause there.
Mm-hmm.
Yeah, number of compounds. Well, that depends, I guess, is the honest answer. It depends on a couple of things. One is the diversity of the compounds for which you wish to make a prediction. And the second is the complexity of the property that you want to predict. So a very simple property, relatively simple, like binding to a well-defined target, will need fewer compounds than something that is very complex and multi-mechanistic, for an in vivo property being the limit, but even something like microsomal stability, where there are multiple mechanisms that can govern that stability. It's not a simple interaction. And then the diversity. So you need fewer compounds to build what we call a local model of very similar compounds with a small domain of applicability than trying to build a global model covering a wide range of chemical diversity. So the two sort of interplay with each other. I guess if you were talking about the simplest end of the spectrum, where you're building a local model of a relatively simple property, then several tens is a good starting point. Ideally you'd like about 100 maybe, but maybe 50, 60, 70. I've seen our users build some very nice models of those sort of simpler interactions. At the other end of the spectrum, if you're talking about a very complex property, very multi-mechanistic, and you're trying to build a global model, well, microsomal stability is the example that I used. I've never managed to build a model of microsomal stability that I'm happy with, that I would say is good enough. Some big pharma companies claim to have done so. They are using hundreds of thousands of data points. And frankly, the published examples that I've seen haven't been terribly impressive. They're statistically significant, but are they good enough to make a really confident prediction? Then I don't know. I would be a little bit cautious about using them. So that's at the very extreme end of the spectrum.
Okay. Thank you, Matt, so far, but seems like a lot of people actually would like to know how to look at this webinar again, how to drill into details one more time. Therefore, we collected a little bit of more information in download. I'm switching display here. So more info and downloads. Certainly, once again, the Optibrium webpage is there to help you further on, www.optibrium.com. The software tools that we discussed here were StarDrop. The Optibrium website has all the details, and of course, you'd be more than welcome to contact either myself or Matt. QSAR is BioSolveIT's new baby for visual lead optimization and SAR navigation. There is a 7 days trial license always included when you download, and this also features the Optibrium ADME property predictions in there. So just try again and just try and download. Free for academics, there is a dedicated website that we have, Tech Trends. You may want to take a look there if you're academic. If you're not, you may want to get in touch with us. And I just edited this on the fly, since a lot of people asked, do you have a Facebook group to be alerted, etc.? Yes, we do, facebook.com BioSolveIT. And there is a YouTube channel into which we will file this webinar. After a little bit of editing at the very beginning and at the end, etc., making sure that quality is okay, and then you can take a look at it again. It's youtube.com/user/BioSolveIT tutorials.